do is the practitioner setup. So recalls are practitioner specific, so you do have to set it up for each practitioner individually. How you can access the practitioner screen is if you close your scheduler, you can go to Tables, Practitioners, and let's find the practitioner I want to work with here. This one here. Okay, so it'll take you to the screen and go to the Configuration tab. You look at the left side, you'll see recall frequency, recall reason, and recall flags. This is where you set it up. So recall frequency is how often do you want a default recall to be set up for a patient. So if a patient comes into the office today and they do not book an appointment, how often do you, like how many days in the future do you want a recall to be saved? So in this case, we're going to say 30 days because we want to see the patient every month. And recall reason, you can just put default recall in here, or you can put 30-day recall, whatever you want to call it. So this is for the default recall. So these options on the left here are quite specific, and it will determine how successful you are with using the recall system. So auto recall patients when billing, what this will do is when you bill a patient, it will automatically create a recall for them for this many days in the future with this reason. So if I bill a patient for today, it will create a recall in 30 days with this reason for me to call the patient back. So this option will result in a large number of recalls being created for a patient. Display recall on cancel no-show. What this will do is if a patient no-shows on an appointment or if they cancel their appointment, it will automatically pop up the screen as soon as you hit one of those two buttons, either the cancel or the no-show button. It will ask you to save a recall for the patient. So let's check that off here. Track recalls on end-of-day report. So it's pretty self-explanatory. It'll just show on the end-of-day report which patients were recalled. And delete future recalls upon arrival. Now this one is important if you have the first option selected. What this will do is that if you have auto recall selected, so keep in mind this creates a recall when you bill the patient. And when a patient comes in for an appointment, if you hit delete future recalls upon arrival, if you have this selected, it will delete all recalls for the future. So this works great if you use the recall system for default recalls. So if you just use default 30-day recalls or however many day recalls for your patients, it will delete those future recalls upon arrival because you don't want to call the patient in before those 30 days unless that's what you're aiming for, but you don't want to duplicate recalls basically. Okay, so having both of these checked off will ensure that you are not overlapping. Now, one circumstance that you do not want to have this selected is if you create recalls, for example, orthotics. If you have a recall, let's say every 2 years or every 5 years for orthotics, do not have this selected because it will delete that recall. Okay, so that's all there is for setup when it comes to the recall. So let's save this here, and let's take a look at what it looks like on the patient side. So if a patient comes in for an appointment and you bill them, so let's just select a patient here, okay, and we bill this patient, so let's save an appointment for them and bill them. Okay, and save like so. What it'll do is it'll create, as long as you don't have recalls disabled for the patient, it will create a recall for them. So you'll notice here that there is a recall button on the scheduler, so let's go in and look at that. Okay, so what this will do is it will show you this screen, which you can also add recalls. So I'll actually go through the screen with you here. So you can manually enter recalls for your patients as well, outside of those default recalls that we just set up. So here, if you wanted to create a recall for a patient, let's say for 14 days, you can do so just by typing in days, or you can use the drop-down. Let's say you want it in Instead of 14 days, you'll say 2 weeks. It'll give you a date option here as well. You can just select the date. And then here, if we wanted to call it, we want to remind the patient about their orthotics and save it like so, we can see it'll pop up right here. Okay. Now, there is a default patient setting at the bottom here, which overrides the default recall setup that we just did. So if you remember when we were in the practitioner screen, this area here overrides that. So if this patient never wants to be recalled, they will never have a default recall saved for them. If you want to recall even if there's an appointment, then just check this one off here. If you hover your mouse over them, it will tell you a little bit more about it. And here, if you want to auto-recall the patient, let's say every 7 days or so, you can enter that right here. Okay. Now, all the patient's recalls will be saved on the right here. It will give you an option, is it complete or not? So if the check mark is in there, that means the recall has been completed. I'll go over that in a moment. It'll tell you when the recall is for and what the reason is. You can also remove the recalls here. So we saved this recall for April the 30th. So let's take a look at that date on the recall screen. So this next part is the day-to-day basically upkeep that you do on the recall system. Okay, so you see here the little alarm clock. This is for the recall reminder list. If you pop that open here, on the right side, make sure that reminders and recalls are selected. Okay, let's find our patient. So we had for the 30th. Okay, so we have our patient here. So when you open that date, so when the date on the calendar flips to the 30th, you'll have all of your recalls for that date shown. If you've missed some recalls, you can click on items in previous 30 days. It'll show you all the ones that you've missed as well. You can complete those. So there's 2 ways that you can complete a recall. Number 1 is you can call the patient, or number 2 is you can email the patient. So there'll be a phone number saved in here. And this option right here, so as you know, you are able to email out of Clinic Essentials to patients. So if you click this little option right there, it pops the screen here. And you create a template, so I just created one quickly for this here. And you can email the patient, you know, we haven't seen you in a while, give us a call, book your next appointment, and you can hit send. What that will do is it will send the recall to the patient. So rather than calling them, you can just email them. Saves you a bit of time. What this also does is it completes the recall. So this little option here will show you the completed items for the day. You can see that this one has been completed. If you do not email the patient, you have to call them to remind them of their recall. And once you've done that, just put the little check marks in here. It'll fall off the list. And that is important to check this off because that will let you know who you've called and who you haven't called. And that way you can keep track of the list a little bit better. So you can see here, if you expand the screen, you can see gives you a bit of information on here. It tells you if the patient has a next appointment, when their last appointment was, what date is a recall, and you know, is it a recall or is it a reminder? 2 similar things, but we're going through the recalls in this case. Now at the very bottom, you also have the option to add a reminder recall right from the screen here. So if you want to add it for this patient here, if you want to repeat the recall, let's say in 4 days, for example, if you did not get a hold of the patient, you tried to call them, you couldn't get a hold of them, you want to call them again in about 4 days, you can just put 4 days in here or weeks, whatever date you want it to be, and hit save. What that'll do is in 4 days' time from here, it will save that appointment, that recall, I should say. So then we switch this here. So 1, 2, 3, 4 days, we can see that our patient is back. So on this day, so on the Monday, when you open your recall reminder, this patient will show in your list as well. So let's switch practitioners back to the original one that I had here and go back to the screen here. So I've saved a couple of recalls on here just to show you what it looks like as well. Again, both these patients do have email addresses in their patient information, so you can email them the recall rather than calling them. Once you've emailed them, it will automatically complete it for you. If you call them, you just put the check mark in here like so. We can see that this patient does have a next appointment. If we were to, so next appointment, so this one is for the 23rd, so a week from today. If this patient were to have an appointment today, so let's book and arrive the patient today, what will happen is this recall will disappear because we selected the delete future recalls upon arrival. Okay, so let's do that now. Okay, so now when you go into the recall reminder list, let's see here, right, that's for today's date. So future recalls, let's go to tomorrow's date, recall reminder. Okay, we can see that there is no recall for the patient any longer. Okay. So now, as we've billed the patient already, what it'll do is it will also create a recall for 30 days, because that's the default setting that we've created. It will create a recall for 30 days. So let's look on that date there. So it should be the 16th, and there's our patient right there. So that's a 30-day recall from the appointment that we billed them on today. Okay, and again, that was controlled under Edit Practitioner, under Configuration. So recall frequency, that's that 30 days recall that we did. Here's the reason for it, and it's auto recall patients when billing. That's what controls it. And then delete future recalls upon arrival. When you arrive the patient, it will delete all of their future recalls. So after today's date, if they have any recalls saved, it will delete that recall. Now, there is one other way that some clinics use the recall system. It is not done through here. It's actually done through a report. And how that report is selected, so let's see here. So right here, recall report, display the recall report when the program starts up if it has not been run. So if you display this automatically, if we log back into Clinic Essentials, this window comes up, okay? So you can print the report or you can view the report. So let's view it just so we can see what it looks like. Looking at this report or printing it will not complete those recalls. Keep that in mind, that if you do use both of these in conjunction, printing this report does not complete those recalls. You still have to go through and complete them. This report is good to call those patients that you've missed. So if you have not been keeping up with your recalls and you want to just catch up with them, this is a good report to print out for that, because you can do that and call the patient. You cannot email them from here either. It will not work that way. This is just a report. If you wanted to catch up with them through the recall reminder list, you can do that as well. I'll show you again. If you go into here, items in the previous 30 days, so this will give you all of your recalls in the past 30 days that you have not completed. Okay. So if you wanted to, let's say for the last 6 months, you haven't been doing your recalls, you would like to catch up with them, do the ones in the previous 30 days previous to April 16th, and then change the month on here. Okay, you can just type right over this, go to the 3rd, so 1603. So these will be all of your recalls 30 days prior to March 16th. I hope that makes sense. So basically works in 30-day blocks of time. Okay. Now, reminders are similar. It's a reminder for you to do something. So basically, if you can click on Remind, we have to select a patient first and then click on Remind. This will just add a reminder. So it's not a recall, but just a reminder that you have to do something with a patient. So let's say you have to send some lawyer documents or whatnot. You can do it right from here. Or if If you offer a patient, let's say every 11th visit, so they come in for 10 visits, the 11th visit is free, you can do it from here as well. So on visit number, let's say 11, you can put in free visit here. So when this patient comes in for their 11th visit, you'll see a little reminder note. Let's save that here. And so let's say on maybe every 11th visit, so not just on visit number 11, so let's change that actually. So on every 11th visit, you'll say free visit, like so. Here you can select where you see it, so either when you bring the patient up, or when you arrive them, or both, or booking. We'll have to change the text on that. So let's say both arrival and patient pop-ups. Okay, so what this will do, when you arrive the patient or you bring the patient up, it will pop up with this free visit. Okay, this can be used for a lot of different things. You can also create one for, let's say if you want to be reminded in 5 days, you want to call patient regarding a lawyer. This will come up, again, when you arrive the patient, or if you bring them up, you can change that as well. So that is essentially the Recoil system. The main points to take from here is just ensure that it is set up correctly, exactly how you want it to be with regards to the auto recall and with deleting future recalls on arrival. That is very important. Again, if you create recalls for something like orthotics, do not have delete recalls upon arrival selected. It will delete those recalls. You can access the recalls from here. So this can be for the individual patients. You have your patient default settings on the bottom left. You can add reminders as well. And you access it from here. This is what you would upkeep every single day. You would go in here and just email the patient. Let's say we want to email this patient here, recall, send, and this one's done. Falls off the list. Next, we email this patient, recall, send, and this one's done. It's a lot easier if you have email addresses for the patients. It saves you a lot of time that way. If you do want to have the report printed out every morning, how you control that is from tables, workstation configuration, display recall report automatically. Again, this will not automatically complete the recall for you. You still have to do that. Yeah, I'll open it up for questions. If anyone has any, feel free to type.